Good evening, Virgin Islanders, and welcome to Season 3 of the Press Box. I am Justa Ortita Encarnacion, your Commissioner of Health, and your host for the evening. Joining me this evening are members of my leadership team for a conversation about where the territory stands in the fight against COVID-19 pandemic and the next step to move our community from pandemic to endemic. With me in studio today are my Assistant Commissioner, Dr. Nicole Cragwell-Sims, Director of Environmental Health and Safety, Wanson Harris, our Territorial Epidemiologist, Dr. Esther Ellis, and our Medical Director, Dr. Ty Camille Hunt-Caesar, who will be joining us later in the show. So, welcome, all three of you. It is always a pleasure to converse with you, whether it be off the scene or on the scene. So this is truly a pleasure for me. Wanson, Director Harris, yes, you have been leading the mitigation team for quite some time. First of all, thank you for all that you have done and for the mitigation team as well. Right now, we're going to ask a couple of questions, and I'll go back to Dr. Ellis as well, but I want to focus on you. So bear in mind the things that come to you in reference to what we've done to mitigate where we are in the pandemic. And then I'm going to turn right now, I'll speak to Dr. Ellis, but I want you to give you an opportunity to think about what we'll be talking about. Dr. Ellis, I want you to give us an idea of what the good news about where we are with the pandemic at this point in time.
Great. Well, the good news is our numbers. Our numbers look great, and if you don't see them, if you're watching, they're posted on Facebook daily and also on our Department of Health website. But today, we had 5 positives, and we tested 557 individuals. Our total active cases in the U.S. Virgin Islands right now are 37. 21 of those active cases are on St. Croix, 14 on St. Thomas, and 2 on St. John. And our percent positivity is at 0.98%. So that's the 7-day percent positivity.
Thank you so much. And what about our vaccine numbers? What are we looking at?
So our vaccine numbers also continue to increase. So thank you to everyone that's gotten vaccinated. Those that haven't, please do so. Individuals that have had at least 1 dose, that is 67,890. Individuals fully vaccinated is 56,137. That means 54% of our population is fully vaccinated. Our 5 to 11 population that have been fully vaccinated is 923. Our 12 and up is 55,183. 18 and up, as the ages go up, the amount goes down a little bit, 52,249. And our 65 and up, actually 86% of our 65 and ups are fully vaccinated.
And that is the population that we were concerned about most when we started the pandemic. Yep. So to see that we had the response where we needed it to protect the population was wonderful. So thank you for that. And I'm actually going to ask you, Dr. Sims, a little bit later on to speak to us about the school initiatives that we've been doing and why, based on the numbers we're looking at, why it's so important to continue to do what we're doing. So thank you, Dr. Ellis.
Yeah, thank you.
Wanson, give us some idea. Let us know what's going on with our guidance right now.
Well, right now we made some changes to our guidance. We're actually relaxing it. We're not out of the weeds yet, but we're relaxing it. Most of the restrictions on bars and restaurants have been lifted in terms of numbers and operating times. So they're going back to the normal operating hours based on the business license. No restrictions on that, as a matter of fact. Most of the questions that we receive is mask wearing when it comes to establishments. And so what we're telling them is that if you're, any establishment that serves food or drink, mask is not required unless you're seated.
And if the establishment is considered outdoors, then there's no mask required. So that's a plus right now.
Now, the fact that we're taking away the mask from those type of establishments, a critical point that needs to be made, and everyone needs to hear this: if you're sick, please stay home. because the fact that we're allowing you not to wear your mask means that exposure is going to be even more significant. So
Yes.
please help us, help you. We know what the guidance are. We just now need to practice them.
Right. I definitely seen after doing some assessments after the relaxation of the guidances, we're seeing that establishments actually following some of them still sticking with the old guidances, and we're seeing we're getting a lot of positive feedback in terms of what we did to help them in terms of keeping the business open, and that was very good to get
Now,
those
going back
information
to the why, right? We still have a few, we still have a few cases here and there, and we also have some hospitalizations. So I want to make sure that the general public also is aware that we're loosening up some of our restrictions. However, we still see positive cases. And Dr. just tell us about our hospitalizations.
Well, we currently have 3 total hospitalizations in the territory. We have 0 on St. Thomas right now, so congratulations, SRMC.
Yes.
0 COVID-19 hospitalizations. At JFL, Juan F. Louis Hospital on St. Croix, there's 3 individuals, one of which is vented. And it's definitely a concern, but it really is a testament to what we have done right to protect individuals. We still are among the lowest deaths compared to any other state or territory. We're one of the 3 lowest deaths, which is really because of all the things that we did to prevent hospitalizations. So I'm very thankful for that.
And I know some of you, we saw some of the, questions come up, not just today, but, when we sit down with the press conference and we listen to it, and the questions are why, the states are, in the mainland they're doing away with masks. We get some questions. Sometimes there's some anger that comes with that, but there's for a reason. We are so separate from the mainland United States. We have to take that added precaution. So, thank you for those of you who are actually stuck with us during it, because, it does play on the mind, doesn't it?
Absolutely, it plays on the mind, but you said something really important. I think there have been some maybe pressers from yourself, Commissioner Dr. Ellis, that explain that we're a small place. So you may have people coming in on a daily basis that and they're like, well, we don't wear masks, and you feel like, well, why not us? But the consideration behind those plans and those guidelines came from a place of futuristic thinking. We know we have one hospital, we have limited staff, et cetera. So, I think kudos to everyone, of course, for listening and following, but the planning portion of it is extremely important.
Okay, and to talk about something that has been somewhat controversial is the travel portal, right?
Yeah.
Do we still have to abide by the travel portal?
Yes, absolutely. Good. Every passenger entering into the U.S. Virgin Islands must utilize the travel portal by going, filling out the documents, uploading your vaccination card and your tests at the usvitravelportal.com. I'm going to clear that up as well. If you're fully vaccinated in the territory or outside the territory, then there's no test needed. However, you don't have that vaccination card, then you need a negative COVID test within 5 days.
So many of Virgin Islanders who are from here but have not been vaccinated here in the territory have been asking that for a long time. So you've gotten what you've asked for.
Yes.
We do have the opportunity now for you to show your card. Like Director Harris said, you cannot just say that you're vaccinated. You have to give proof of vaccination wherever you've been vaccinated. We have a list of approved vaccines that we are accepting. So you have to meet that criteria, and then of course you can you receive your green QR code. A code that everyone likes to see.
Everyone likes to see.
Green is like
Okay, what about going outside? In terms, let's say, for example, the BVI. Do we have to still take a test to travel to the BVI?
Yes, we work closely with the BVI, Government Environmental Health. Kudos to them. And so once you're leaving the USVI to enter into the BVI, they're requiring a negative COVID test within 24 hours of traveling if you're not vaccinated. So we asked for 5 days, they asked for 24 hours.
Now, let's look at the flip side of that. The BVI is international, and so are our surrounded islands, right?
Absolutely.
So, besides Puerto Rico, outside of Puerto Rico. So we know that if they are coming into the Virgin Islands, being U.S. territory, and they're international, they have to show vaccination and a proof of
A negative COVID test within 24
There we
hours.
go.
Not a positive test, a negative test within 24 hours. And that mandate came from the
That's a CDC mandate.
CDC mandate.
Not a USVI mandate.
Nope.
It's a CDC mandate. So we can't change that. That sticks. You spoke about wearing masks in a restaurant and bar already, so I don't want to belabor that, but that's something that I know individuals are looking at. Going into establishments, it's important to wear your mask, though, isn't it?
Going into the establishments, moving around the establishments, as long as that establishment is considered indoors, have a roof, 3 walls, it's indoors. You must wear your mask as long as you're moving around. However, Commissioner, I can say that most establishments, the cooks, the staff in the back, fully vaccinated, no mask required.
And they've been asking for that for a long time.
And they've been asking for that.
It's also a comfort, level of comfort, especially if you're working for hours and you work amongst each other for a very long period of time. So.
Absolutely.
Now, this is a question that I've been asked in several venues, and is social distancing still required?
Yes, definitely.
First, could you define social distancing?
Social distancing, in other words, being able to separate from another person 4 feet apart. So we're asking for social distancing in crowded areas, especially if they're not from within the same household. However, there may be situations where you're unable to social distance, and that's where that handy-dandy mask comes in. So.
Okay, and especially when you know that you have symptoms. I keep going back to that because you walk around and you see people coughing. You're not supposed to use your hand, but you still see that, and we will have colds.
Yes.
However,
yes.
Being just coming out, we're not quite out of the pandemic yet because you notice we still have numbers and we still have hospitalizations. Yep. But it's important that if you are symptomatic in any way, cold-like symptoms, that's a symptom of COVID, so please don't forget, stay away from others, protect the others.
Correct.
Yeah, we're getting some great comments too on the thread. Lucy, she said, "I'm going to try to continue wearing my mask outside." So if you want to wear your mask, you can. If that's what makes you feel comfortable, if you're immune compromised, if you're taking care of an elderly parent, you are welcome to continue wearing your mask. It's just that it's not required outside.
And the Division of Environmental Health, we consult a lot with businesses, establishments, and so some of those establishments has continued to maintain their 100% mask wearing, and we support them. We support every establishment within the territory. As long as they're keeping the people safe, we're good with that.
You ran the mitigation team.
Yes, I did.
I know, that was a controversial team, okay? Don't think that we made it easy for ourselves. We had different individuals on that team, and we had battles sometimes, okay?
Yes.
Commissioner, could you please join the mitigation team? We need this handled, okay? So that happened quite a bit. So talk a little bit about the mitigation team, and then speak about what is left right now. The governor made some decisions, and where are we right now with that?
Right. So prior to the relaxation of what we had, the restrictions, the mitigation team met every Monday, Wednesday, and Friday to vet every event that has more than 15 individuals. We look at the venue, we look at the vaccination rate, we look at the activity, how safe it can be. Some of those, we approve a lot of those. Some of them were unable to meet what we needed. However, we actually went from a reviewing to a monitoring, meaning any event more than 999 individuals, just have to submit the special event request. Events that are fully vaccinated, no mask required. And so we're not out of the weeds. We're still looking at certain events, but those large-scale events, parades, Juve, it's one of them, right? But that's why we're looking at more than 999.
Juve in front of Dr. Simpson.
That was a very good music.
We have to go to a break, and we'll be back. But one of the things you're speaking about is events, and I know that we have St. Patrick's Day coming up, so we're going to be speaking about that as well. So thank you very much. Don't go away. We'll be right back, okay? Thank you.
But what you saying, Jenny? Me saying a hot minute, you know. We're going to say that it's been a hot minute for a reason. You want to know something? My mother told me that I can't come out my house because of COVID-19. I know we ain't safe out here for a little bit, but still I just have some fun though. Well, my say I can't leave the house unless I'm vaccinated. But you won't scared of the vaccine? Nah, sis. The vaccine's safe.
VIP people, you must stay at work. COVID-19 is not a joke. It's much more than good hygiene. Give your children the vaccine. Education is the golden rule. Children need in-person school. They miss music, dancing and sports. Vaccination is better than worse. I want the COVID vaccine. Give me the COVID vaccine. It's safe, mommy. The vaccine safe, safe, safe. I want to see my friends and family. Playing with them makes me happy. It's safe, mommy. The vaccine safe, safe, safe. Children can become infected, get sick, and spread COVID-19 to others. Widespread vaccination is a critical tool to help stop the pandemic. People who are fully vaccinated can resume activities that they did prior to the pandemic. The MCH division encourages you to get your children ages 12 years and older vaccinated. I want the COVID vaccine. Give me the COVID vaccine. It's safe, mommy. The vaccine safe, safe, safe. Brought to you by the Virgin Islands Department of Health MCH program.
Welcome back to season 3 of the Press Box. And of course, I'm here with my leadership team, and we're just discussing the last big event that we canceled, and now the first big event that we're going to open, and that is St. Patrick's Day. Director Harris, tell us about that.
Yes, so 2 years ago during the pandemic, the first event that we were unable to approve was the St. Patrick's Day event. I'm proud to say the first event that we're approving is the St. Patrick's Day event. So we're going to have fun downtown Christiansted. Come out and celebrate with us St. Patrick's Day. So it will be fun.
But it's going to be a little different than we normally have it, correct?
Yes, you're going to see throughout the streets a lot of hand sanitization machines. We're asking individuals, sanitize your hands as often as possible. If you're unable to social distance, especially if you're not living in the same household with people around you, wear your facial covering.
Please, okay? You have to really and truly have to stay safe. We just sent out a press release in regards to that too, so look for the press release as well.
Yeah.
Dr. Sims, the community itself played a really major role in curbing, our epidemiology our numbers, okay? So tell us, but still we took a hit.
Yes, definitely.
Emotionally, psychologically, as well as physiologically.
Yes,
Now,
yes.
Dr. Hunt and Dr. Ellis speaks more about the physiological part, but tell us about more. What have you, speaking with Brennan Steele, tell us a little bit more about what's going on, because just because the pandemic is looking like it's over, guys, not quite over yet, we still are feeling the effects, and what kind of resources have been used and can still be used?
Yeah, well, actually, that's a really good point, Commissioner, because none of us were alive, and if you were, hey, kudos to you, when the first pandemic came about. So it was brand new to every single person. It's like, what do we do? And we've often spoke about this being a Caribbean culture, touchy-feely, huggy, we're all together. So we had to strip those things away for the greater good. And one of the things that the Department of Health did so well is we shoulder to shoulder the pandemic. We weren't above it. We weren't in a different bubble. We were all in this together. And so we made that very clear. And I think the community, at first, there was a little tantrum here and there, but we were able to show them how important it was to follow the guidelines. And so when Dr. Ellis mentioned things about being in the 3 of all of these persons or states or territories that has so many fatalities, though we've experienced that and collectively we've mourned, we feel that, we are in a much better place because collectively we came together. And I think now from a psychological perspective, like Director Harris said, some of these places are still following the guidelines because as people over 2 years, habits form in 21 days. So you're going to do it, but I think there's a sense of calm with it now. And so people are like, no, I'm actually okay with that now, and I don't mind doing that now. So,
But there's some people who actually went through depression.
yes, we did have a lot of people that went through depression, and DC Steele and his team, in conjunction with our federal partners, we had grant opportunities very early on, which we utilized and partnered with some amazing clinicians.
Are those opportunities still available?
The opportunities are still available.
And how can they tap into them?
You can tap into those by going to the Department of Health website, the Division of Behavioral and Mental Health. There are a lot of links to not only local programs, but national programs for the vets, suicide prevention, things of that nature.
And our hotline is still up and running, correct?
Yes, yes.
So could you tell the viewing audience the numbers that they can call, because they can tap into the hotline to also request counseling?
Yeah.
So can you help us with that?
Yeah, and also, getting COVID is quite stressful, and a lot of individuals were able to recover at home, but it's very isolating to do so. So every COVID positive, as well as close contacts that we identified, were offered free counseling as well, and given, referred for services, and many did take that, take advantage of that opportunity. The hotline numbers are 340-712-6299 and 340-776-1519.
And if I could just add something really quickly that we've also realized in that division and, as clinicians, survivor's remorse. There are a lot of persons who, as family members, were positive, but other family members may have, succumbed to COVID, and that really put them into a depressive spiral. And I think that's something that, we need to recognize is happening and know that people are experiencing it. And so these types of resources will help persons to get out of that.
I don't think that there is anyone who was not impacted by COVID. I had 2 deaths in my family as a result of COVID, and I know you experienced
about 7.
Yes, and we all did. You had a sister-in-law who died of COVID, and we all experienced that. And so it's not easy to sit and say that everything is okay when everything isn't.
Absolutely.
So thank you both for speaking about that, and thank you basically the community for being part of the solution, for going out there, not just getting the vaccine, even though the vaccine is the ultimate cure or mitigation effort, because just because you get the vaccine, it doesn't say it's 100% that you won't get COVID, but the chances of you getting severely ill and dying is significantly diminished at that point in time. Yes. And most of our patients that have died, I think we had 2 deaths thus far that were fully vaccinated, correct, Dr.
That's
Ellis?
correct, 2 fully vaccinated deaths. Those 2 also had a lot of other underlying health conditions that contributed to that.
And so now we say this to say, our numbers are down, but not necessarily gone away all the way. So you still have an opportunity to become vaccinated just in case we have another surge coming. We did not expect Omicron, did we?
No.
We were ready to say COVID was over.
We were ready.
And it has to be a Mr. right?
In November, I was like, bye, COVID.
Bye.
We're good.
Yeah, it has to be a guy for
Okay.
sure.
Mr. Omicron, sorry, Mr. Harris. Mr. Omicron decided to pop his ugly little face and say, and most of our deaths occurred.
Yeah, actually, over 25% of our deaths occurred with the appearance of Omicron.
And one of the things that we've done now is the school has opened. Students are back in school. However, you heard Dr. Ellis speak about the fact that a low percentage of our school-age population has been vaccinated. What are some of the things that we're doing, Dr. Sims, to help that?
So what we're doing is, of course, a lot of this COVID information has really been over the heads of teenagers, so there weren't connections early on. So what the team has been doing is we've been putting together educational slides and presentations and giving the opportunity for Q&A on their level, like removing a lot of the big terms, et cetera, so that they understand how important it is to take the vaccine. And so we've been infusing that and, watching the numbers crawl up as they trust us and we, help them.
So mommy and daddy and grandma and grandpa and auntie and uncle, when your little ones come home to give you the benefits of having the vaccine, I need you to say, something? Let's listen down and listen, because listen to what they have to say, because they're learning from the experts.
Right.
And we're also providing an opportunity for you to be there and learn with them. So take that opportunity.
Absolutely, Commissioner. And you did mention something. The mask mandate is dictated. It comes with the percentage of vaccinated person, and so. For the schools, students are required to wear the mask inside the classroom and on campus. And, I had a conversation with some parents yesterday, as a matter of fact, and so, I had to explain that the vaccination rate amongst school-age children is very low.
Right.
And that's why we have to encourage that mask wearing in school.
Plus, many schools just went back. And so we just started public schools. We want to keep them open safely. And so it's considered, it's a non-overnight congregate living facility. It's a day where you're, in a small space inside with a lot of people that you don't live with all day long. So we want to make sure that they stay open.
Right.
And one of the things that we're doing with schools also, we're not just encouraging vaccines, but we're also saying we're testing them. So we're doing quite a bit of testing on a monthly basis just to be sure that there are no positives. And if there are positives, that we pull those positives out and separate them. Now, some parents actually have been questioning whether or not we should be testing. And the answer to that is yes, because we want to keep your child, your children in school, and we want to keep them in school safely. And it goes back to, if a child contracts COVID, that child goes home to an elderly grandparent or parent, or to a young parent that have multiple comorbidities, which also puts them at risk.
And the behavioral health component too, we've attached that to the students. So they have really like a little, triangle of care. So if there are any types of feelings about it, they have that resource too.
One of the things that we just started, and that is DC Steele, Deputy Commissioner Steele and his team, I think they've done 2 events thus far, and they're going back to do more. They're in the high schools. So could you tell us a little bit about what we're doing there?
Sure. So the team, they would select, on the DSM scale. There are a lot of things.
What's a DSM scale, please? Could you please?
It's an assessment tool.
Non-clinical for us today.
It's an assessment tool, basically utilized to see anxiety, depression, the levels. So we all pretty much experience that. So mental health is your base, and then you have spikes, kind of, through it. And so what the team has done is the first wave was on depression, and really and truly, simple definition. If for 2 weeks you're in a particular sad state, then by the DSM scale, you are depressed. And so what they've done is they did a presentation, and then we had the van parked outside so that you enjoy that presentation. But if you feel that way, you have that privacy, you have that, that trusted space that you can utilize.
How have the reaction been?
Well, when you see a big old van driving up on campus, you're like, what's going on? Ice cream? But, not necessarily. But I think the feedback was pretty good because it's not only students, it's also teachers and staff, which that compliment is really good. So I think it went well.
I've heard so many positives.
Yeah.
And I have to tell you that Deputy Commissioner C is very quiet.
Yes.
He doesn't say much.
Yeah.
But when he gets you on the phone, he says, oh my gosh, Commissioner, this went so well.
Yes.
The students were excited. They asked so many questions. Really and truly, thank you for allowing your students to be part of that. And we are going to take a little break, and we come back, we're going to have the massive Ty Hunt Caesar here with us to answer some more of your questions. See you soon.
Has the COVID pandemic caused you to fall behind on your rent? What about your electric or water bills? Well, VIHFA's Emergency Rental Assistance Program is here to help you catch up. For program details and qualifications, go to VIHFA and click on the ERAP link. From there, it's just 3 steps. 1. Make sure you are eligible. Have you lost income due to COVID-19, owe at least 1 month of rent or utilities, and meet the federal household income guidelines for your island? 2. Gather all the required ID and documentation for all members of your household, plus statements from your landlord or utility company. 3. Submit your application online at vihfa.gov or call one of the intake centers on your island to make an appointment to apply in person. For more details and locations of the intake centers, please visit vihfa.gov.
Welcome back, everybody. We have here with us, I know I always tease her, the massive Ty Camille Hunt Caesar. I got that from Senator James, you know that, right?
Absolutely. Thank you. Good evening, everyone.
Good evening and welcome. Thank you for joining us.
My pleasure.
So one of the things that we're going to speak about, first of all, what was your role, or what is your role right now as in the Emergency Operations Center?
In the Emergency Operating Center, my role is the healthcare branch lead for the Unified Pandemic Response.
Good. And you are our medical director in the Department of Health.
Yes, I'm the medical director in the Department of Health, overseeing all clinical operations, and I am an infectious disease physician by specialty. So the COVID pandemic response is really my area, and by training, so it has been very, very fulfilling to actually lead the healthcare response, and has been very rewarding.
Yeah. So when the pandemic started, and Dr. Christensen was working with us, and she was like, "You think we could get Dr. Hunt back?" I was like, "You think we could get Dr. Hunt back?" And so we made a phone call, and I guess, can we have her for like maybe half a day, 2 days a week? We stole her. Mr. Smith, so thank you so much. We have been having tons of fun, learning so much from you as part of the team. So thank you for that. Okay.
Oh, absolutely, my pleasure. I mean, we've all been learning. I've been learning as well. So we've learned from each other, and just for the benefit of the community.
Thank you so much. Listen, we are in a pandemic. Mm-hmm. Everyone is asking, what is the difference between a pandemic and an endemic?
That's a very interesting question. It's an excellent question. I think the question should be shifted a little bit, though.
Go ahead.
It should be the difference.
Dr.
Oh, absolutely. and Dr. Ellis, Esther Ellis, can also be helpful in the discussion too. So it really should be a question of what is the difference between a pandemic and an epidemic. Those are the terms that can be sort of discussed or compared. So pandemic is, when you have a disease or a virus in this instance that, affects the many different nations, international, a global effect. Epidemic is when you have a smaller effect, when it's sort of identified in smaller geographic locations, not on global proportions. When you talk about the term endemic, you're not referring to necessarily how it relates to populations necessarily, because when you're referring to endemic, it belongs to a person, population, or it belongs to an area. So when people start to talk about, when is it going to be endemic? Well, actually, it's already endemic because it is existing in our community. So if you have a disease or an entity that is actually already existing in a community, then it's already endemic. So it's to be determined if it's going to actually go away or if it's going to just linger on a smaller basis, and then we consider it endemic. For example, dengue is something that is endemic to our region, but we don't see dengue every day. So if you get to an endemic portion or an endemic situation for COVID, then you're going to have to wonder, when is it going to have small epidemics or outbreaks eventually?
Good question, good conversation, but let's talk of the regular flu, right? Mm-hmm. Do we have flu throughout the year?
So we see flu throughout the year because we have a population where we see transient people that come in and out. So there is a flu season where you commonly see an increase of cases, and that's because you have areas where you have colder times, and then you have more people that are clustering inside, and that's when you have a lot more spread in the flu. Do we see flu all year in the territory? Yes, we do, just not necessarily at increased levels. So there is a flu season where you're going to see more, but in the territory, we can see flu sort of all the way throughout the year in low levels because we see people that come from colder areas on both sides of the world, in the northern hemisphere and the southern hemisphere.
And just to add to, we do test for flu. So there's a respiratory panel that most providers run. It has 18 respiratory viruses on it. If someone comes in with flu-like symptoms, we're seeing low levels of flu, not because we're not testing for it, just because it's not really at high levels right now.
Right.
Absolutely.
And during the high areas of the pandemic, our flu levels were very low, and partly because everyone was wearing their masks.
Mm-hmm.
Washing their hands.
Absolutely.
Hand sanitizer.
Mm-hmm. So there are a lot of benefits, and basically it's really just good hygiene.
Yes.
You know, the mask is just an additive, but it's good. It's really good hygiene. And we just had an art contest, and one of the art, I think it won second prize. I don't know if I can't remember if it was St. Croix or St. Thomas, but it spoke about the art, a small piece of material meaning so much. And I'm paraphrasing, but that was really the context of the art. And it showed the art, the mask on St. Croix, St. Thomas, and St. John around it. It was just a thought alone. I have to say that those students really topped it off. That's just one that I'm speaking about, but there's so many. There were some emotional ones as well because they too experienced death in their lives, and they were able to express that. So you know you're looking at that. Yeah. Can someone still? You've heard the numbers. We just spoke about the numbers. Can you still get COVID-19 today?
Absolutely. Absolutely. The answer is yes. So as Dr. Ellis stated, we have 32 active cases in the territory. Mm-hmm. So we can still get COVID. And again, we have to watch the world to see what happens globally. If we still have countries and where you have significant pandemic or very, very high cases of COVID, and you still have the amount of travel that we have every day that happens, then we're going to continue to have the potential of acquiring COVID. The one thing we can do is try to do our best to make sure that we can, to prevent that, which is to get the vaccine, to make sure that you do have antibodies already on board in your body that can prevent you from acquiring the ill effects of COVID if you are indeed exposed.
Goes back to the prime reason for vaccination.
Absolutely. Prevention.
And prevention, that's right. And that's what public health is all about, right?
Absolutely.
Trying to prevent. A question for you in terms of boosters. Mm-hmm. Let us know who should be getting the boosters, when should they get the boosters?
So everyone who meets the criteria and who's eligible to get a vaccine, actually, anyone ages 12 and older Okay, it should get a booster after being fully vaccinated. So if you are fully vaccinated with either 2 or 3 doses, completing your initial vaccine series, 5 months later, you should get a booster. And that the booster is only recommended for those ages 12 and above. The 5 to 11 age group is still being determined if indeed they do need a booster. And that would be no more than 4 doses, 3 or 4 doses of the vaccine. So it gets complicated because some individuals who are moderately to severely immunocompromised actually complete a first dose series with 3 shots. Right. The regular general population completes it with 2 shots. So after your second or third dose, 5 months later, you should get a booster. The reason why you should get the booster is so that you can be protected against all of the variants that we have seen thus far with the COVID pandemic. So that is who should get a booster.
Do you think we'll have another variant coming up soon? And if we do, is it going to be as deadly?
That is to be determined. We have not seen any emerging variants pop up in the last 3 weeks of surveillance that we have actually studied since about mid-February. We have looked at the trends, and that is when we no longer saw any cases of Delta being documented in the nation. And since then, we haven't had any emerging variants, which is good news. However, we still have to wait because this is exactly what we saw right after Delta before Omicron came out. And the only way that we can be safe is if we actually get the globe and the entire world vaccinated at the same time, because these variants actually emerge in communities where you have low levels of immunization rates. So our population is actually at risk of actually being one of those areas where a variant can emerge. But we have to look at the whole world to see what the trends are looking at. And so far, we haven't seen any other variants of concern.
Thank you. Do you remember that movie? Are we there yet? Are we there yet? Remember that movie?
Yes.
You know, the little one in the back? I'm sure you experience that all the time now. I remember that, those days. Are we there yet? You know, when can we say COVID-19 is going to be over?
I think that's to be determined, and I don't think that we know, actually. And I used to always say that we'll know when we know, right? We'll know when we see a significant extended period where we don't have the significant surges and rises. So we keep hearing on the news all the waves, the 3rd wave, the 4th wave, the 5th wave. I can't keep up the waves anymore. So we're gonna have, once we see, several months where we don't see any surges and peaks, then I think we'll probably enter into the phase of dealing with an endemic disease, and when we will be looking for pockets of outbreaks so that we can strategize and really put on mitigation at those targeted outbreaks so that we can prevent any additional surges.
Thank you so much, Dr. Ellis.
Well, I just wanted to add too, we'll know when we get there. But also, there is going to be a vaccine available for under 5. I know a lot of people have been asking and wanting to vaccinate younger children. So that is in the works. I don't know what the timeline is for that yet, but I do think it's close. So as soon as it's available, I know we'll be announcing that and letting everyone know that it's available and what that is. So the 5 to 11 vaccine is 1/3 of the dose and is 2 doses. The even younger will probably be something similar to that.
Do me a favor. Could you go onto the website and make sure that you can let the audience know where they can actually go to receive more information on COVID-19 besides our Facebook page?
Okay.
And of course, repeat the hotline numbers when we can go, where and what time, because we've reduced some of our and then also speak about the pop-up testing, where they are. So
yeah,
okay, I think
definitely.
that's. But
Right.
while you do that, we have St. Thomas Carnival activities coming up. Whoa. Okay, Nicole? So she has been also waiting for this for some time now. So is it still mandatory to get vaccinated to enter some of the carnival events?
It is, absolutely. One of the things that Director Harris and his team did, and it's been a theme in tonight's discussion, we're not out, we're not out, we're not out. So please don't think, things are relaxed and they're just broken. They're not. And a lot of these events are vaccine only, and you have to show proof of that. Our team vets that. We pretty much know maybe by now who has it and who has not, because we've been doing that mandatory vaccine event thing for a while.
So were we working very closely with Department of Tourism?
Yes. Department of Tourism has been an amazing partner in this whole thing. I really must say, I think we need to change the name of our department, right? We work on it. But it's like alphabet soup, because everybody's just been doing amazing. But we've been really working hand in hand with all of the events, providing guidelines and structure along the way. So.
Okay. Well, thank you so much for all of that. When we come back, we'll have a complete discussion of COVID-19, where we are, what we need to do differently, if we need to do something differently. So don't go away. We'll be right back to speak with you.
You going, Timmy?
Yeah, check out tomorrow. I better not see a grain of sand in my car, eh?
Terrence, hurry up. Let's go.
It's a bunch of haters, man, because I just sweet and I need to talk to you.
You see you later, right?
Put on all your seatbelts. Let's go. Hold up to me. Terrence, what are you doing? Buckle up.
Man, I'm in the back seat. I'm getting right around the corner to the house. Nah, boss. People will be speeding down this stretch all the time. If you really want to live to see Crystal later, you got to buckle up.
Ridiculous. Let's go, Timmy. I gotta go home and get fresh anyways.
Me know what Crystal's saying you anyway, dog.
Seatbelts save lives. Buckle up. It's your life. It's our law. This message is brought to you by the Virgin Islands Office of Highway Safety.
Welcome back, everyone. We've been actually getting some questions, so thank you so much for your questions, and we will, Dr. S is going to help us read some of those questions. Could you please?
Yeah, so one of the questions was, what is the vaccine made of? So, Dr. Hunt?
Yes, very good question. I know that a lot of individuals are very concerned that there might be toxins or chemicals or preservatives in the vaccine. They do not. They do not contain any chemicals, preservatives. The vaccines are made up of simple sugars, proteins, everything that already exists naturally in your body, and then the actual vaccine particle that is made up of a little piece, a little dead piece of the COVID virus, so that it is triggered, your body is triggered to think, and it's fooled that it's think that there is the virus present, and then your body naturally produces antibodies against the COVID virus so that it's already present. So no chemicals, no preservatives, only sugars and proteins.
There's a question thank you for that. There's a question I forgot to ask you, and you know we have the long haulers. Tell us a little bit about what does that mean, because we've had a significant amount of individuals who've been hospitalized, and even those that haven't been hospitalized, they may have some long-term effects.
Yes, so that condition, what we consider long COVID or the long hauler syndrome, is something that you can have if you've actually recovered from COVID, but you're still having the symptoms and effects. So we personally have know individuals who we work with and we love dearly who have had symptoms of long COVID. And that could be chronic shortness of breath, just feeling tired excessively, and what we call or consider brain fog, in which you just sort of lose concentration. You're just not as sharp as you used to be. So many different symptoms can just happen for a long period of time, including losing your taste, losing your smell. Sometimes that doesn't come back for several months. But that's why it's very important for people to understand that it's not cool to just have COVID. They're just saying like, I just want to get. No, you don't want to get COVID because you don't want to potentially have long-term side effects, which should be something you should be considering. Even understanding.
Even if it's just a taste.
Absolutely.
Because I have to tell you that I have a niece who had COVID before the vaccines, even though she still hasn't gotten vaccinated. Okay. But she's still really interested, but she still can't taste.
Yeah.
And she still can't smell. And so that is definitely something that's been bothering her.
Absolutely, it's very bothersome.
How can you enjoy food?
Correct.
You know, it's something that sounds simple, but for her, it has not been. And there are others out there as well.
And even just walking around, just some people just take for granted that they're just going to get better, but sometimes the effects are lingering. So then just getting up and moving around, they are very fatigued and just out of energy. So it's really not something that you want to get, because you'll have to actually have physical therapy. There's something called COVID PT, COVID physical therapy, that we offer at the hospitals for those who are recovered, and it takes a long time to get back to normal.
Thank you. There's something that was on the radio this morning. I think it's important for us to clarify. First of all, the federal government extended 100% of the cost share for our federal dollars. So for FEMA, there's not a percentage that we have to pay and FEMA has to pay. It's 100% covered by FEMA. So that was extended until July 1, correct. So July 2nd, we go back to 90-10. So it's still good, but not as good as 100%. As well as Title 32, which allows the National Guard to assist. So two things. The federal funding from FEMA allows us to pay for contract workers that's now being caring for patients in both our hospitals, our nursing homes, helping the Department of Human Services, BOC, and of course the Department of Health. We are still in contract with them. So just in case you were wondering, because I heard that was spoken about on the radio this morning, they have been paid consistently, and we're up to par with that with the help of ITEMA and FEMA. So definitely, of course, in the Office of Disaster Recovery. So we're doing very well with that. And so all of our clinical staff, our professional staff, are here with us and will remain here with us until the federal funds are no longer here. So that has been extended. I think it was important for us to clarify that.
Yeah, that's excellent news.
As you brought that up, Commissioner, it's really important for people to understand, too, that we needed those partnerships because we still have a Department of Health to run.
That's right.
TEMA still has to run. BOC still has to run. Everything didn't stop for COVID. So having those has been...
And I always say, Department of Health is not just about COVID.
Correct. Yeah, that's true.
I always say that.
You do.
We want to make sure that our divisions run the way they should be ran outside of COVID. COVID just happened to join us. And now we really want to say,
yeah, they overstayed their welcome.
Yes, we're ready.
There were two more questions on this.
Of course, go ahead.
One was, what does the booster do? And will there be a pill for COVID? Maybe someone that doesn't want to take a shot would be willing to do a COVID pill.
Okay, so what does the booster do? The booster just extends the level of immunization, because after a certain time, if you're vaccinated, your immune system or the antibody levels in your body might start to go down. So the booster does exactly what a boost means. It provides just a boost, or sort of a memory to your immune system to trigger more antibodies to respond, so that it's high in your body for a longer period of time. A COVID pill. So the pill, or what we call the oral antivirals, have been developed for the treatment of COVID. It's not in exchange for a vaccine. So there is never a substitute for the vaccine. We always want everybody to be vaccinated. But in the event that you do actually contract COVID and have symptoms, the oral antivirals we do have in the territory at 5 participating pharmacies throughout the entire territory, including St. John. The names are Paxlovid and Molnupiravir. So these 2 antivirals are available to be used and prescribed by your physician or a physician if you actually have COVID symptoms and have it within 5 days. You have to take the pill within 5 days of having symptoms, otherwise you really would, the pill will not be beneficial.
Dr. Hunt, there's another medication also. Let's say you're severely immunocompromised and you cannot for some reason have the vaccine. What is it that you can actually take to help you increase your immunity level?
These are all excellent questions because I facilitate the therapeutics for the COVID therapeutics in the territory, and all of these tools that we have received in the territory have been extremely life-saving and have prevented people from being in the hospital. And to date, we have utilized about 1,000 treatment doses of monoclonal antibodies in the territory. And what the commissioner is referring to is one of the monoclonal antibodies called Evusheld. This is actually a monoclonal antibody that we give before anybody has actually received COVID as prevention, and it's only indicated for those individuals who have a medical contraindication, who cannot receive the vaccine for an allergic or a medical contraindication, or for those individuals who have been vaccinated, but unfortunately, because they're on immunosuppressive medications, for example, for cancer treatments or systemic lupus, even though they were vaccinated, their immune system may not probably actually mount that adequate response to the vaccine. So we still want to protect those people, so that monoclonal antibody can be given as an injection and provide a 6-month protection for COVID.
Okay, thank you so much for that. That was important because I know that's one of the things we've been missing. We're now in closing remarks. This has gone fast.
Very fast.
Yeah, thank you. And I know that
the union. It's like a 2-hour program.
I know that Director Harris isn't here, but I want to thank him too for being with us today. So, but give us a few 30-second remarks.
We're not done. We're not out of it. COVID is not gone. That's just, we just need to remember that. We're in a better place, thankfully, to all of you who have been vaccinated and continue to accept all the therapeutics when the Department of Health calls you. But just keep wearing your mask if you want to, because my mother has vowed to always wear her mask forever for the rest of her life. She doesn't care if there is no COVID that we say. So please continue to do what you think is the best for you and protect yourself and your family.
Well, I, of course, naturally, I'm going to appeal to your mind, body, soul, and spirit and ask you to take things one day at a time, one 24-hour period at a time. It will definitely help you, and it would help to sustain your mental health as we all go through this together.
Thank you so much.
Well, Commissioner Encarnacion asked me earlier to talk about our testing sites, and also that was the last question on the thread, so thank you to the person that asked that question. But our testing sites are open every day, so if you're sick or you're a close contact to someone that had COVID or you want to get a test, you can actually schedule it online at covid19.usvi.care. You can also get more information about COVID at our website, which is covid19usvi.com. Our pop-up testing is every Wednesday on St. John from noon to 3, from noon to 3 at the Vipa gravel lot. And then we also have once a month pop-up testing the last Friday of every month for VIDE. And the next one is March 25th, and that is from 3 to 5. At either complex on St. Croix or Old Cinema 1 parking lot on St. Thomas. So that's, yeah.
And that's the testing that we spoke about, keeping children in school. Tomorrow we sit in front of the Senate, and we sit to ask the Senate to actually extend the state of emergency. And it's because of this. We are not finished with COVID. We have clinical staff, our providers who have really been inundated with caring for the population. Right now, we're looking at long haulers. We're looking at long COVID. What is it's going to be facing us in the future? We're not ready at this point in time. We want to make sure that we have enough staff in our hospitals that are our staff for the next few months, increase our level of staff, and then we can say we're more ready. And then, like you said, give it 3 months. Let's see whether or not we're really out of it, and we don't know yet. But going back to you, thank you so much for being part of the solution. And really and truly, we've learned from you, you've learned from us, we'll continue. Thank you so much and have a blessed evening.